All right. Obviously, many of you are here today to learn more because you've already heard about the National Health Service Corps. And it's a part of a branch of the government called HRSA, H-R-S-A. And it's one of the branches that helps professionals live in underserved areas and encourages them to do that so that they provide services to those people who don't have access typically or very limited access. The health service has been going for 30 plus years. And our part in it, psychology's part in it, counseling, for the first 23 years was to not have much involvement. And in 2002, I went to a national conference to find out more about it. And when I got there, there was a room of about 500 people. And they were all people that were wanting to be an ambassador for the program and take it back to their communities, to their schools. And they asked the room of people, they said, how many nursing people do we have in here? Half the room stood up. How many physicians in here? 3/4 of the room stood up. How many psychology people stood up? There was 2 of us. And I looked across the room, and we looked at each other and waved and said, let's talk. So afterwards, we made a commitment that day to bring in 100 people in the mental health field because we had been underrepresented for many years. And part of it was a funding issue. They had allowed funding to go to people to go to school, and then a very limited amount for after school in the community, licensed. And what they found was a lot of these physicians and people that they were funding would go out and live in an underserved area for a couple of years and then leave. So they said, let's take the funding and do a reversal. And let's fund this amount to school and this amount to go and work, and then we'll pay for your loans. And that's when we jumped in, when that happened. And I got a chart that I'm gonna show you here shortly that kind of represents the idea of how it's progressed in those 8 years, 7, 8 years. We are still being, I don't want to use negative language, we are still being not highly considered for scholarships. We can't even apply for scholarships. So we're the only professional group, mental health, that can't for scholarships to get paid to go to school. Even with all of our success in the program, we cannot get scholarships. So don't even, and in the student service to loan repayment program, nah, not going to happen either. Only place that we can apply is after we've been licensed and after we're out in the field. Now, there's a lot of sites all over the U.S. You can go on their website and you can check it out. And let's say you want to go to your home state and you want to go to your hometown and it's a rural area and you want to set up a shop. They would probably help you do the paperwork to get that site set up and approved. Now, typically they're going to say it needs to operate for a year to see how many patients you're going to run through to make sure you're going to meet the criteria. But if you can set up a shop, a lot of our graduates from here have done that. They've gone out, and I have a video in a little bit, and I'll show you the video that a couple of our graduates have done that, and they've pretty much got their loans paid for. So here's kind of the government bureaucratic departments and how it breaks down. I'm not going to spend a lot of time on that. This is kind of the reason it was created, and mental health is a component of this, but it's been very heavily physician and nurses emphasized up until 2002, 2003 when we raised a lot of stink, and we did. So there's kind of the history of it. And this is, we're at over 10,000 providers now in that time. Okay. Check that out. What does that show you? What we've done in 7 years for loan forgiveness. And initially they were excited. They even gave me this little tiny cheesy award for bringing 100 people to the next meeting the next year. But then they kind of started getting annoyed with us because we started really doing a good job of promoting ourselves and our clinicians, master's level, doctorate level, out in the communities and getting them aware of how to do this. And that's why I hope a lot of you are here today, so that you can also carry this on. This is such an amazing thing, because if you'd have looked at this before 2002, it would have been about 2% of psychology or mental health. So, here's the good stuff. That's what they pay you to put directly on your loans. If you get in the program, get approved, they will send, well, they won't send you. They'll put a direct deposit to your checking account, your banking account. You'll look at your statement one day and go, oh shit, look at all this money. Where did this is a screw up. Oh, wait a minute. They gave me right, I got the National Health Service Corps. Well, you can't go gambling. You can't take trips. You can't do anything with this money. They own you at that point when it hits your bank account. You need to take and write a check, a big check, to your loan company, or go to your bank and say, transfer this. Don't even mess with the check because it's a lot of money. And send it all to your loan. And watch your loan go, and then the next payment due goes clear out. 20, 30, next payment due. The idea is most people get this. If they get it, not that. Now, there's a third-year option, a fourth-year option, a fifth-year option, a sixth-year option, a seventh-year option, based on your loans. And if the more underserved area you're in, the higher the score. And I'll explain why that's important in a little bit. I talked to a recent graduate, not recent, probably about 2002, 2003. I saw him at Walmart the other day. He's with his family, and we hadn't seen each other for quite a while. And I said, well, what's going on? And he said, well, you won't believe what's happened over the last several years. And I said, well, tell me. He did 2 years at a rural site in southeast Missouri. Got tired of driving. His family lives just south of Springfield. Decided to work with his church and set up an independent outpatient mental health clinic and just use his church as the place to do this. HRSA helped him. He got set up and he applied and he got it. So he got a third year, a fourth year, a fifth year. His loans are almost gone. And that's just in Nixa. Now, one of the things you always want to remember is if you don't want to set up a site, you don't want to open a private practice or a group practice, you want to go someplace to do this. They have on their website job searches. And if you go on the website, it's a big website. It may take you some time, but you'll find it. And then you can look up each individual state and say, okay, who's hiring for LPC, MFT, psychology, and go, I'm going to work there. That's where I kind of want to live. I need to go get a job. Hopefully you know the clinician that's there. If it's a rural area, it's probably not very many people. They've probably been there for a while. They probably know everybody in the community. Hopefully you can get on. Once you get on, they cannot negotiate your salary based on this. And some have tried. I've had students call me saying, well, I went for this interview at this place. They said, well, because we're giving you the National Health Service Corps, which is not a guarantee, you can get a job there, apply, and still not get it. They wanted to pay me this. Wrong answer. They can't do that. They cannot use this because it's not a guarantee. And even if it was like a really high score, because the higher the score for the site, the better your chances of getting it, they still cannot use it. So remember that. Shady people. All right, so you find a site, you apply for the job, and let's say you get it. There's a job center. It's this stuff, I'm not kidding you. Just when I get the website figured out, it changes. Just when I can find stuff, it changes. This is like a continuous government throwing money at a website development. And if finally they've went online, so you can get the forms online, you have to upload your forms back online, and they've made it a lot easier to apply. Now, there's also a way to get sites approved, and that's another, probably a whole nother hour conversation. But mainly, I just want you guys to kind of get familiar with, why is it stopping? There it is. Okay, site scores. There's the initial amounts and awards. And you want to go to a site that's a 14 or above because of the difference in, this is a recent change. This is in the last couple of years they've changed this amount. It used to be 50,000. Then they changed it to 60. Now they're back down to 40. And they're basing it on site scores because it used to be the same amount no matter what the score was. Now they're kind of looking at it and going, oh, how can we fund this differently? You can even do halftime. Now, I haven't heard of too many people getting halftime. I imagine it's just not as an ideal situation for them to approve when they've got all these people applying for full-time. But it may be an option. I love this, back up. I love this part here. With continued service, NHSC providers may be able to pay off all of their student loans. How awesome would that be? Right? They allow you to do teaching, which they never did in the past. You can teach part-time as a component if you're teaching in an area that's underserved. At a university or college, maybe in that area that's underserved. Remember, their whole focus is providing services to underserved. When you apply, you send in a kind of like an application that says why you're qualified, and in it has essays that talk about your experiences with the underserved, your research with the underserved, your interest in the underserved. Why you, and I'm telling you, when I went to one of their meetings, I don't know if any of you guys have done Amway before. My parents dabbled in that many years ago, and it got kind of cultish. This is even worse. It's like everybody gets together in a room and they all tell stories about the underserved. And it's a warm experience. It's not creepy, but it's like really getting into serving the underserved. So you're going to be one of those people. You're going to present as one of those people. And you're not going to say, I'm just doing it to pay off my friggin' loans. What are you, crazy? No, you're going to go in and you're going to say, I have a desire to work in an area that's underserved, with underserved kids or adults or whatever. And our program really, I think, promotes that. We're in an underserved area. The whole state of Missouri is underserved. We pull students from underserved areas, rural areas. It just goes together well. A lot of our practicum experiences are in underserved areas. So it couldn't have got better for us the way we were positioned when it all changed the funding source. And we got involved and really started understanding it. Eligibility requirements. This is the big thing that I always get asked. Yes, you have to be licensed. It can't be provisional. You have to be fully licensed. You cannot apply. You can get a job at one of these sites, get supervision, yada, yada. Until you got license from the state that says rubber stamp, you're ready to go on your own, you cannot apply. Which kind of sucks because your internship, residency, or any type of practicum or LPC provisional status, you still go work for peanuts. And they know that. And it's wrong, but it is what it is. Okay, here's the mental health people. There's the websites, and I can post this on 360 somehow. I'll find a way, and that way you guys can go to it, or you can just go to the NHSC .hrsa.gov, and it really will explain everything. Now, primary care has been the big new thing in the last 3-4 years. And all FQHCs, federally qualified health centers, are automatically an approved site. So as soon as they open, they're automatic, and they're probably going to be a 17. Because if they federally qualify it as a primary care site, remember, even despite our success, which a lot of people are not happy with, physicians and nurses still get the higher, more focus. That's a nice way. They get more focus than we do. But we're starting to put a lot more mental health people in primary care settings, so that's a good thing. Rural health clinics, primary care outpatient clinics, Indian Health Services, correctional facilities, private practices, solo and group, other health facilities. Now, they tell all this. When there's a lot of money, almost all these sites will be available. People from correctional facilities will apply and they'll get it. It depends on how much the president decides to put into the program. In the last 4 years, there's been no money put in. And it's not based in political avenue, because it's both groups have put money in. It's just the amount that they're talking. 4-5 years ago, they put in $600 million. They couldn't give this money away. They were begging for sites. So correctional sites, in the last 4 years, correctional people started getting wind of it. They started applying, and they got approved. Several of the faculty here that work at the Fed Med, they're in it. But before that, or since then, I met with the director of HRSA, wonderful person, and I cornered her. And I said, all right, what's up? You apply, you get it in a jail or prison, then it goes away. And now it's coming back, and I'm going to guess it's going to go away. And she said, come here. It's kind of like one of those side conversations, away from everybody, that she can tell me the truth without anybody knowing it. In our press releases, this is what she tells me. In our press releases, we have to screen the words correctional inmate out because people throw a fit. Yet, in their material that they send to me to present to you, what's listed? So it's really, there's some politicalness behind it on who's going to say we're going to fund behind the walls, and that's behind the walls. So if you want to get a site approved, and you maybe know a psychologist, counselor, somebody out there in a rural setting that isn't doing it, it doesn't cost them anything to do it. And if it can help you while you're there working for them or with them, why wouldn't they do it? You gotta monitor some patient demographic population statistics. You gotta have some programs in place, which they provide, and they provide the training for. They'll give you the software that says you can track all of your patients, all your clinicians, all of the patients that come through. They want data to support the money. So That's the only thing that they have to do other than fill out some site forms and approve your hours and send it in. It doesn't cost them anything. And that's the big hang up with a lot of them. We can't afford to put somebody in charge of that. It's nothing. You could do the work. They got to verify it and sign off on it. Sites must accept patients covered by Medicare, Medicaid, children's health insurance programs. You got to have a sliding fee. Now, the clinic has been an approved site since 2003. And people that have been there, Diane Ellis, Dr. Ellis, she worked there and she paid off a portion of her loans. We also have a sliding fee category, and we have an independent practice category that we bill insurance. When she was in the Health Service Corps, she saw Medicaid, self-pay, sliding fee people. Now that she's not in it, she can go over to the private practice and bill full service. Now, one of their big stinks, HRSA. This is the branch that oversees the National Health Service Corps. One of our friends is the director of the regional HRSA office in Kansas City. He's worried that in the past, mental health people have been manipulated or taken advantage of salary-wise because of it. And that's what I said earlier. And he is trying to fight that if you start a site that you have a salary versus a per patient contact percentage, which that doesn't happen in our field in private practice groups. You're not paid a salary. You're paid on who you see. Well, if you're only seeing Medicare, Medicaid, or sliding fee, your income's not going to be that high. So our profession doesn't work that way, but they're trying to make it so that if a site gets approved, they pay you a salary that's equivalent to what they make, even though you're going to lose money, probably, for that organization. And that's going to be the fight. I could see that changing. I don't know how they're going to do it, how they're going to work it. Now, another thing that's happened to some of the students, they've gone to a site, Community Mental Health Center, CMHC. And they started working, and the site said, okay, we're going to make you see 40 patients a week, because the no-show is about 30%. So in order for you to meet the qualifications, you have to see this many people. Well, they're abusing you. The reality is you only have to schedule so many patients a week. Not see, schedule. And they're taking advantage of the clinician because they got the loan forgiveness. So once you get to how to apply, you go online, you download the forms, you fill them out. They've made it a lot easier. There's state primary care offices that will help. There's regional directors from HRSA that will help. They want their regions to do well, so they will send people to you, to your office, to your site, and help you. They will do site visits at your site. They will do everything they can to help you because they are in charge of making sure that their region does well. And I have the contact information for the Kansas City region. I think it's Region 7. Some states will match money available. I don't know if Missouri does that or not yet. I'm still trying to find out. So they'll have their own little loan repayment program that's matched if you kind of meet the criteria for the National Health Service Corps. So there's other ways that you want to look into. There's the Health Service Corps, which is entirely different. You wear a uniform, you may work on a reservation. If you get a chance to talk to Dr. Vince Barnes, he's at the Fed Med. He also probably, I'm going to guess, will teach here some classes at some point. He is or was with the Health Service Corps, where he was stationed in South Dakota, worked on a reservation, and had his loans paid through a different branch of the government. So there's other avenues, you just need to explore them. There you go, yeah, Region 7. That's Kansas City. And I know the contact for this office, and he knows all the other ones because he's been there for about 9 years. So if you need to, let's say you're going to move down in here someplace and you need to contact this person, we'll call. You can call me, I'll get you the name, and we'll hook you up. Now there's ambassadors in all these areas too, and they should know a lot bit about what's going on, but that's kind of like going to a therapist when you have a heart disease instead of a cardiologist. Here's your cardiologist, and I'm your therapist. You have heart disease. Who are you going to go see? Cardiologist, who can really do a lot of good things and a lot quicker than I can. So ambassador is a fancy title for nothing. There's the person you want to hook up with. The regional coordinator for HRSA. His name is, give me a minute, Clark Conover. Clark Conover. And he's Forrest's friend. He's really helped us a lot. There's some other sites. Now, one thing I have learned, we've had students apply, and we're a little over, I think it's probably about $4.5 million now, isn't it, Philip? Probably in loan forgiveness for our students. That's a lot of cash. And we stopped tracking it, so there's probably people that are doing it now that I don't know that are doing it, which is good. They should be able to tell us exactly how many. They probably don't want to tell us, is what I'm guessing. If you call in, you may get, if you call 10 times, you may get 10 different people. So if you have a question and you don't like the answer, call again. I had a person, it was in Dallas area, and their office was on this side of the street, and the underserved population was on this side of the street, and all the underserved population came across the street to their clinic. But because of where they were located, they couldn't get a score. I said, keep trying. She said, well, it can't hurt anything to keep trying until I get somebody who will agree. Well, guess what happened? They got thumbs up. They got approved. She got 2 years. They came back in and said, you're not on the right side of the street. She got 60 grand. So never say never. Don't give up. And don't believe everything you hear on the phone. And they are slow. It's a government organization, remember. They are slow to respond to any type of email, tech help, anything like that. Primary care offices, another good level of people to help. We had one primary care person in this state that wouldn't allow one of our sites, one of our students. I called him myself and said, you've got other places just like it here in town, and you won't approve that one, even though they're the same thing. Even they probably see more underserved at this one, but these have been in the system for 20 years. This one's just now trying to get in, and you won't approve them. All of a sudden, magically, it happened. So it's, greasy, get that wheel, what's it called? What's that phrase? The squeaky wheel? Yeah, we got some grease. Give me some of that grease. Primary care associations, community support, AHACs, state offices. Again, all this stuff you can look up. Let me play the video. There was a student, about 2000, graduated in 2010, about 2008. He was kind of a techie guy, so I hooked him up and said, let's make a video about the National Health Service Corps and what we do. And this is that video.
Holder, and I'm Program Coordinator with the Lawrence County Cooperative School. We serve programs during the day for approximately 35 individuals that live in Northeast Arkansas. We provide training for these adults in daily living skills. There's times when we have crisis areas, we have to wait several hours before we can get help. And from what I can see and what we have experienced in the past, we need more mental health services in this area.
I'm Sandy Babel, and I'm employed with the Lawrence County Cooperative School in Portia, Arkansas. We recently had a situation with one of our adults that we had to remove them from our group home, and we needed a behavior management plan. In this rural area, no one can provide that service for her. We wound up having to go to Central Arkansas, and didn't even succeed there. They said they couldn't provide one for us. We're just at a real loss sometimes for help, the help that we really need to help these individuals.
Hi, I'm Dr. Fuge. And I'm Dr. May. I grew up in a rural area, Grove Springs, Missouri, and when I was growing up, I remember that we had to travel over 100 miles just to be able to see a physician. And during that time, there was not a lot of psychologists around, and found that a lot of people were struggling trying to find services. So I decided when I finished school that I wanted to come back to an area and help the people who were like us.
I also, like Dr. Fuge, grew up in a rural area in Oklahoma. Our population there was, there's probably about 300 people in our town. I knew when I started the profession that providing service to the rural areas and getting services out there that people can get to easier was definitely something that very much motivated me and knew I wanted to do from the start of my professional career. One of the things we realized is our mission is very much consistent with the NHSC, and so we started researching that and started the application process to become members with them because we very much share their goals in providing services. Our application process, again, we started in January. I think we started applying and filling out paperwork in February, and we found out last month that our site has been approved.
Mansfield's a real small community. We have about 1,200 people living in this town. We provide services to a lot of different types of people. Majority of them, probably 95% of them, are on Medicaid or below
poverty level. Dr. Fuge and I started this clinic here in January of this year, so it's very short-lived. And even when we were talking about our name,
we decided to call our clinic Rural Psychologists and Associates because we wanted to let people know that we were out there in the rural areas and willing to provide the services. We service about 7 counties of people.
Different counties, yeah. And have people driving in an hour and a half away to get services here. In fact, we have several saying that other services they have to drive to that they can't get in except once every 2 months.
Right.
And so for therapy and stuff, and it's been taken off pretty good. I mean, we've got a lot of people excited that we're in the area.
I'm Steve Akeson. I'm a licensed psychologist in Missouri, and I've been practicing for about 10 years now. And I had already been working in rural areas, coming from a rural area, and in the course of working in these areas, found out about the NHSC through their ambassador program and was accepted. Our practice primarily does assessments, and I go to 3 different small towns outside of Springfield, and then I also have an office here in Springfield. So we provide services to people from over radius of over 200 miles from this central location. We feel that we're providing services to a very broad area in about 6, 7 different counties in this area. I was born in western Nebraska. My dad's a farmer, and so I grew up in an area that was underserved. They closed the hospital in our town when I was in grade school. So I'm used to the idea of underserved areas and the difficulty in recruiting professionals. When I was in first grade, we had a substitute teacher who decided that I was ADHD. Eventually, they were able to find someone to do the testing, but it took almost a year to find someone to come in and actually test me. And when they got done, they decided that I wasn't ADHD, that I was gifted and probably a little bored, which was a better outcome, I guess. But in the process, I became interested. It was my first contact with psychologists. I became interested in the field, and so the opportunity for me to go into that and to continue to work in small areas has been something that I've been proud to be able to do.
My name is Robert King, and I'm a licensed psychologist at Robert J. Murney Clinic of Forest Institute. We have a dual mission here, and one of the missions is to serve the underserved population of Southwest Missouri and the Greene County area. And then the second part of that mission is to train graduate students. So we have a really good sliding fee scale that actually starts at $7 per session on up to $55. And through the work of our students, our graduate students here, and also the providers that we have here through the National Health Service Corps, we're able to meet that mission. 70% of our clientele are actually employed. So we service a lot of employed individuals who are part of the workforce here in this community that otherwise wouldn't be getting mental health services. 89% of those of the clientele here at this clinic have no insurance, so they may be employed without any insurance, or they may be employed and be underinsured. So they come here and they can pay on a sliding fee scale and actually be seen for mental health services. So I believe that our dual mission, both in the training aspect and a focus on the underserved, serves this community as a whole. So I believe that we are meeting not only the mission of this clinic, but also the mission and the purpose of the National Health Service Corps.
I'm Dustin. I'm a doctoral student here at Forest, clinical psychology. I'm also from a very rural area in northeast Arkansas. That's kind of one of the main reasons I got involved in this. I think there's a real need in areas like that, especially where I was at. It was a population less than 500. When I first heard about the NHSC, I was really excited because part of my goal in the future is to serve places like this, rural areas that are underserved for sure. So I think it's a great opportunity and something that could help people like me move forward and help people like this out, because I still consider it my home in an area that really needs some attention.
When we found out about the NHSC program, we were both really excited because we're both from a rural area, and we both believe in serving underserved populations, being from that area and seeing the great need.
It's just like someone saw the same goals we did, and they're going to allow us to fulfill our goals. Who knew it would be made that much easier by a program with the same kind of, dreams and aspirations that we've got.
I came from a really small town too, probably a little over 1,000 people, and the main profession was farming. So, you were a farmer or you weren't. And so, in ways of health profession, you pretty much just had doctors, medical doctors that you went to if you had a problem, and there wasn't really any type of mental health professional around that I can remember. I can't even actually remember a clinic. So, for most of your people who did have some type of mental illness issues, they didn't get services. Part of my desire and my wife's desire is to be able to go back and serve communities like that.
I want to be able to bring that back. I don't want people to feel like there's nothing out there for them.
NHSC, here I come.
NHSC,
Here we come.
NHSC, here I come.
NHSC, here I come.
Are you ready?
That's on the Forest YouTube site, so in case you want to show it to anybody else. Questions? Questions? Any questions? Random questions?
I have a question.
All right.
So if they deposit $60,000 into your bank account, do you have to pay taxes on that?
No, that's the nice thing about it. They have they pay the federal taxes on it for you. It's a good thing.
see a minimum number of stipend fee or Medicaid a year?
You want to be able to show that you're serving the underserved versus just a bunch of insurance and then getting the money for not seeing underserved. And they check your records. They do a site visit with after the first year. And, you know,
See all.
you don't have to see all. It's just it's a good percentage. And they don't really have any set formulas, and you can't really pin them down on anything. But they have the ability to say, we're going to extend your contract another year without paying you anymore to make sure that you see enough. And they told stories at their training about if you got a job at a site, got the National Health Service Corps, got into it with your boss and got fired. You have to get another site very quickly. They will help you with that. And if you fought them over it, they told a story about a guy that they sent to Alaska. So it's kind of like Guido and his brother will come see you if you sign on the dotted line and get that check and don't follow their rules. Firstborn child named after them somehow, you know. Questions?
Then it's based off of percentage of people you see instead of number of people, because if you're seeing, like for assessments, you're going to see fewer people than you do to get there.
Yeah, and you could put it into face-to-face contact hours. So if you're doing assessment and you're doing the assessment, you don't have a psychometrician or somebody else doing it, then yes. Because Dr. Akeson did a lot of neuropsychs and other psych evals, but he also saw therapy cases. And they'll tell you, yeah.
Can you discuss the loan repayment part that you heard from students today? I know they have different options of how they can take those payments. You know that?
Well, one of the things that happens is if you get it and you see that check and you go, oh, party time. And you come back to reality and you go, okay, now what am I going to do? Am I going to pay this over time? They will send you free of charge to one of their conferences that everybody who got accepted can come to, and they'll pay for it for you to come. At least they have in the past. I don't know what they're going to do since they don't have as much money being funneled in. And then they go over all the options for payment. Like, you can't gain interest on the money. So you can't invest the money. You can't do anything with it. You can't go, downstream. Here I come. Let it ride. Crap stable. So I've always encouraged people to dump it all in there. But there have been others that have figured out some payment thing. Now, that could have changed and I haven't heard about it yet. And I can't find it on the website. So it may be one of the things that you call and ask about. Can I pay this off in chunk? As long as I'm not making interest? Can I pay it all at once? Can I pay it over monthly? As long as I show that I put that much money in that loan. But you just can't make interest, so it's got to be a non-interest bearing checking account and I just would be worried it was sitting there. Oh, bought some new stuff. Oh, I didn't have enough in there and it got into the loan. Oh, geez. So I'm going to have to send that TV back or that car back.
Did you say earlier that people are able to start their own practice as long as it's in an underserved area?
Yeah, you can. Those two people, Janice and Loretta, they were students. They started the Rural Psychology Associates. They went to Loretta's hometown. And now they've since split. And they both have their own sites in the same town. And they both got the same scores. And they've both been doing the loan forgiveness they got to be about done. Because that was 2004, I think. So they got to be awful close, or 2005, by the time they were licensed. And they also have internship sites through the consortium, Heart of America Consortium. And they take people most of the time from Forest. They have practicum there too. So you can go do practicum, you could do your internship, you could stay on, do your residency, get licensed, and then apply for loan forgiveness. Or if you know someone that's a psychologist or a counselor or whatever in a rural area that isn't doing it, that could do it, and that could hook you up, that's another option too. So you can start your own site, you can go to a site that's already been approved, or you can develop a site. Yeah.
So you said the FQHCs are automatically enrolled in that program?
Yep, FQHCs are automatically qualified, and they probably got a site score of 14 or above.
Right, so but you don't have to do paperwork on them then, since...
You don't have to get the site approved. They're already an approved site. You have to apply and then still go through the match process.
Okay.
And the way they explain it to me is it's 0 to 21. 21 is the highest you can go, most rural area. And they go through the U.S. and they go, okay, we're going to start with all 21s across the U.S., all people that have applied. And we're going to start going, okay, we're going to fund this one and this one and this one. And then they go to 19, then 18, and then 17, 16. And then if they get through all that and they still got money, they go back through it and go 21, 20, 19, 18, 17, 16. So the lower the score, the less likely you're going to get chosen. But when they had plenty of money, they couldn't give it away. And something that happened when I talked to this, the director of HRSA at a conference, she says, this was probably 3 or 4 years ago, she said to me, we can't get enough people involved for the money that we have. We had 2,200 people didn't fill out the app right, so they were immediately disqualified. She threw a fit and made her whole office change the whole application process because she tried to fill it out and she couldn't fill it out. She was bent out of shape because it was a pain, man. It's like 19 different documents and forms you got to fill out and redundancy and confusion. I looked at them, I'm like, shit, I'm out. Somebody help me fill this out, please. So it's a lot easier now. Questions? Got to have questions.
For funding the program, has it basically been surviving off that initial deposit 5 years ago, if they haven't been throwing anything into it?
No, they haven't thrown additional into it. There's a certain set amount they throw into it. I don't know what that is.
Oh, okay.
I don't know how many millions that is. Because if you think about it, there's 10,000 people in it. I don't know how they include those 10,000 number-wise. Are they contracted? Are they out? They were a member, now they... I don't know how many every year there are involved that are in it. Then if you get overlap, okay, I'm in it for 2 years. Next year's cycle comes in, you go apply, you get in it. We're in the same office. There's 2 in it in the same office. But I'm in my second year, you're in your first year. How do they figure out? It's got to be a nightmare, but somebody's got to be in charge. I don't know who. I've been figuring that out. Nor I imagine they don't want anybody to figure that out.
At the end of your 2 years, you get your loan.
No, you get it up front before you start.
Oh, okay.
You may even actually be working already and you applied in here and they didn't tell you until here that it started here. And you'd already been working. It's the government, okay? It's not very easy to figure out. I've had people that didn't know. They applied, kept working, they were going to work there anyhow. And then all of a sudden they looked at their bank account and literally had a panic attack. Oh, look at this. Ah! I'm in it, and I didn't even know it. And then they get the email that says, congratulations, you want to come to one of our conferences? To learn now that we own you. And that as soon as your bank accepted that money.
What about health psychologists? What is that? Like, I understand what that means, but as far as this program goes, in order to qualify, are there
You got to be licensed. Doesn't matter.
Okay.
Licensed LPC, licensed marriage and family therapist, licensed counselor, licensed psychologist. Doesn't matter what kind of psychologist. Psychologist, licensed.
I didn't know if that health service provider that you see on the...
HSP,
Yeah, I did
that's
know.
a state designation. That just says that about the only thing that's good for is that you can supervise residents, people in their residency year. Other than that, it doesn't really mean anything other than they collect another $100 from you at the end, every 2 years. Yeah.
If you apply and you don't get it, can you reapply to run it?
Yeah, you can apply until until you're done. Yeah. And you may get it, and then after 2 years, they don't re-up you because at the end of your second year, like 6 months before, they'll send you an email. They won't send it to you. You got to just start looking. You re-up your app, and then they determine if they're going to give you the third year. And the third year is like 40. So if you get the first two, it's 60. The third year is 40. Or you may go 2 years, apply again, and then get it again. But they already recognize that you had it. So honestly, I'd love to see this process because it's got to be just crazy.
What happens if you have like 55,700?
They pay a percentage.
Okay. And there's that much extra in your bank account.
They pay a percentage of, no, wait a minute.
Okay.
Maybe I'm missing
They
something.
give you that, your loan
They give you the
amount is
60.
one thing.
Okay, here's your 60.
Yeah, but your
And your loan is only for 55.
Yeah.
Then they're going to only give you a percentage of your loan. They may give you 40
Okay.
instead of 60. Because some of the people that have been in it for multiple years, when they got down to that, I get one more year, it'd be 35,000. I only got about 22 left. They may get 18.
They give you what you need to pay it off.
No, they may give you less than what you need.
They're not gonna give you more.
They're not going to pay it off or give you more. I mean, who's complaining at that stage? If you were in it for 4 or 5 years, you were living in an area you were okay living in, you were working, doing the kind of work you planned on doing anyhow, and your loan disappeared and you didn't really touch it. Now, I would encourage you always to pay on your loans, even if you get the 2 years and it pushes your next payment date out to 2030. Interest. Pay whatever you can. Don't just go, I don't have to pay. Maybe I'll die before then.
So if you have like 3 different loan places, would you suggest consolidating them and then just paying them along?
Now there's something about the consolidation thing you got to be careful of, and I don't know enough about it. So you're going to want to talk to one of their representatives to go, okay, if I consolidate, does this hurt? Because they want to look at all your loans that are related to school and how they determine what's school related, what's not.
Because I have 3 different providers who own my loans.
Yeah, so they're going to ask for all that information. And this is where I could see some of the confusion getting in the place when they go, send us all your loan information and send us all who has it and what it is and what it was used for. And you got to verify that you didn't, go out and buy a new Lexus and call it a student loan, which some of our students have done. Yeah. Other questions about it? Typical questions people ask. What do I need to be doing now? Nothing. Doing what you're doing. Staying focused. If you want to do a dissertation or a research topic or do some research and present it at a conference that may be an underserved based conference, that might be good so you can put it on your appy when you get there to apply. That you did something that represents an underserved group. You can emphasize that, why you're more special than the next that's going to apply. We have had tremendous success. I hope the success continues. I hope that they throw a bunch more money into it. Because when they do, it's just like people who never ever thought they could get it. And even if it's 2 years and it's $60,000, that you don't have to pay, and it knocks off that interest as well. Sweet. Any other questions? I know it's a lot of stuff at once. Go to the website, check it out. Check out the jobs, your area, where you're thinking about living. Even in big cities, there's underserved areas. So just because you think, oh, okay, I want to live in Detroit. Well, that doesn't necessarily mean that there's not something in Detroit, or there couldn't be something in Detroit. You may not want to live there, but you could commute. So work with the regional coordinators from HRSA. They from my experience, every time I've had a student call and say, okay, I'm in this area of the country, who do I talk to? I get them in touch with that person, and they come to their office, they go through their paperwork, they help them fill it out, they help them get it set up, because they want to see more sites in underserved areas. And just because you're in a site that say Springfield, when Springfield first started, it was an 11. Now it's a 9. And my guess is it'll be a 7 here pretty soon, because of all the providers that are now in the health service corps in this town that are taking advantage of it. They're going, wait a minute, this town's not that big. There's like 100 psychologists, 50 or 75 counselors, and 25 marriage and family therapists. And it's not underserved anymore, so we're going to lower the score. Other questions? Get excited? Huh?
What are some other states besides Missouri that are considered completely underserved?
I don't know.
Okay.
I
Is that
don't.
on the website?
I don't know, but you can go to the website and look. And you can call the HRSA people and find out. I honestly don't know. There's some places I would have thought for sure were, and they weren't. I think there wasn't enough people. Any other questions? Exciting stuff?
Is there a way to find, like when you're looking at different areas of, say, a town, I feel like whenever I've looked at it before, it shows job openings. Will it show you all the sites anyways, just so you know kind of what's in that area, or is it pretty much only what's open right now?
They're trying to get it, I think, they're trying to set up so every site that's a potential or has been that maybe is filled now, that might come open, but I think what their current thing is just job openings, job searches that have an active site with an active opening. Now, if there's an active site and an active opening that's the same today from when you get licensed, there's a reason that site's open. Probably the person that owns that site is antisocial and abusive and going to take all your money and work you like a dog, and there's a good reason that site's open, in other words. If it stays open every year, there's red flags. You can go check it out. Just check it out. But be cautious. If you like them right away, like within the first 30 seconds, probably run.
Is that an option? If you get in a place where you're really unhappy, you don't want to quit, can they relocate you?
They could, but it's a lot harder, and they may find a place for you.
Are hospitals a no-go?
Well, that's an interesting thing, because up there it says primary care outpatient that are associated with hospitals are. Not for profit, yeah. So, other questions? If not, we're done.